Hi, I'm Marisa Schoen, and I'm one of the second years at Wills Eye Hospital. The training over the past 1.5 years has been incredible. We have such high clinical volume that really exposes you to a wide variety of pathology, and the mentorship is excellent. We are so privileged to get to work with leaders in every single field, and also the residents are fantastic. I think this program draws the best of the best, and we get to work closely together and learn a lot from each other. Wills has a lot of strengths. In particular, I think the emergency room is one of the highlights. It is an incredibly busy ER that is dedicated to eye pathology, and we start working there as first years, where you get to really build your skills and your knowledge base, because you're just seeing so many different problems, from corneal abrasions, metallic foreign bodies that you have to remove at the slit lamp, to highly complex neuro-ophthalmologic problems that require extensive workup with neuroimaging. And then you kind of progress to your second year, where you gain more autonomy, and you're continuing to build your skills and knowledge, but also working on efficiency, communication, leadership, teaching the first years how to run the ER, build their differentials, manage patients, and then working more independently along with the faculty who are supervising the emergency room. As a first year, you usually work with one second year in the emergency room, but who you work with rotates throughout the year. So you get to learn from a lot of different people who contribute in very different ways. But I think the constant amongst the seniors, which is a culture created at Wills, is very selfless, compassionate teaching. The ER can get very busy with 20 to 30 people on the board at times, but I think the culture is, we're very invested in helping and teaching each other. So as a first year, the second years always were happy to stop whatever they're doing and take the time to explain things to me, see a patient, to go over what the findings were, so that I felt really comfortable with the care that I was delivering. And that's something that I'm continuing to try to do as a second year myself now. In first year, your surgical experience is mostly with pediatrics and plastics. So in pediatrics, you do strabismus surgeries, which is really fun. And then in plastics, you're doing external orbital cases, working with the eyelid and other procedures. And then as first years, you're also doing a lot of bedside procedures, oftentimes related to trauma, doing emergent canthotomy, cantholysis, lid lac repairs, but not so much intraocular surgery. That really comes into play as a second year, where you start to do your first cataract surgery cases, and then third year is when things really take off and you're doing a lot more complex cases with all the anterior segment surgeons. And I think all of this is now going to be really exciting to see how the new wet lab factors into our training. It's already had such an amazing impact on building our skills and giving us a new level of comfort before operating in the real setting. And it has just state-of-the-art technology. There's 8 stations, so 1 station for every resident, an amazing technician who makes sure that the supplies are well stocked, 2 ICs where residents can go in on their own time to practice their surgical skills. But I think all of this wouldn't really matter without the faculty who've really taken the initiative to build a curriculum to work with the residents, and it's customized to each year and what's appropriate for their level. So that's been really exciting to see, and I'm grateful for the opportunity. I think what really resonated with me was the model skills with compassion. I went to Jefferson as a medical student, so I had the privilege to work with a lot of the residents and the faculty here. And I was just constantly in awe and impressed by how great they were as clinicians, but also as people. And they were people that I wanted to surround myself with as a resident and who I aspire to be. Philadelphia is great. I've been here for 13 years now. I haven't left. I truly, truly love it. As someone who's come from the West Coast, it has all the amazing opportunities, a lot of things to do, great restaurant scenes, a lot of museums, easily accessible outdoor activities. Not to mention it's very affordable, walkable, bikeable. I actually bike to and from work, which is a great way of getting around, but there's also amazing public transportation. And I think the people in the city are great. There's a lot of pride, especially in their sports teams, which is fun to watch year-round.